Senator Humphries.
Thank you, Mr. President. My question is to the Minister representing the Minister for Health and Ageing, Senator Ludwig. And I refer the Minister to the Australian Institute of Health and Welfare's report into hospital statistics, which notes that visits to emergency departments in Australia are growing by 5% a year. In the Australian Capital Territory, an average wait time in an emergency department is 10 hours. Bearing in mind the Prime Minister's promise to fix the public hospital system by next Tuesday, can I ask, does the Minister regard people waiting for 10 hours in emergency departments for treatment as the kind of fix the Prime Minister had in mind?
Minister representing the Minister for Health and Ageing, Senator Ludwig.
Thank you. What we do regard as is good health and hospital reform is putting $64 billion over 5 years into it. Unlike those opposite who thought the good for the health system was in fact to remove $1 billion from it. Unlike those opposite, it is very disappointing to hear those opposite complain. But I welcome the latest report from the Australian Institute of Health and Welfare and the contribution it makes to the accountability and performance of hospital systems. It is clear that public hospitals are continuing to experience pressures in relation to elective surgery and emergency department activity. The government is implementing lasting reform to alleviate this pressure on the hospital system. And I think, Mr. President, the real issue is we are implementing lasting reform. We have a COAG agreement. We have looked at both health and hospital funding, but we have also said that we would put $64 billion over 5 years, which is provided through the National Healthcare Special Purpose Payment, which now goes beyond hospitals and covers other areas of the health system, and the National Partnership for Hospitals and Health Workforce, Preventative Health and Indigenous Health. The Hospital and Health Workforce National Partnership provides funding of $2.5 billion, including $154 million for a more nationally consistent system of activity-based funding. It also provides $1.1 billion to train more doctors, ensures that it also for training nurses and other health professionals. There are also $500 million to improve subacute care services. But in addition, when you look at the achievements within the ACT, when you break that down, and I know those opposite, particularly the senator for the ACT, would be interested in knowing that the ACT government has received $10 million for reducing.
Your time has expired. Senator Humphries.
Thank you. Supplementary, Mr. President. I'm glad for that clarification. I had thought the Prime Minister, when he was promising to fix the hospital system, was talking about outcomes, not inputs. The same report from the Institute of Health and Welfare indicates the median waiting time for elective surgery across Australia was 34 days last financial year, 2 days more than the previous financial year. Again, in the ACT, it's more than double that, 72 days wait for elective surgery. What does the Minister suggest that I say to my constituents who were promised a system that would be fixed by now, but instead have a system which is actually falling apart?
Minister.
Thank you, Mr. President. It is one of those areas that I know the senator for the ACT has an interest in. I know he prefaces all his remarks to constituents that when he was in government he participated in ripping $1 billion out of the health and hospital system. We've said time and time again, we've been in government 18 months, we have put our money where our mouth is. Those opposite did not do that. When you look at the emergency department funding, the Rudd government will deliver $750 million to state and territory emergency departments. The ACT received $10 million of that. That is $10 million that wasn't there, that is now being provided for elective surgery. There is also stage 2 of the program to ensure the ACT also can get $6.6 million for capital works at Canberra and Calvary hospitals, because it isn't going to be a system that's fixed overnight after the mess the Liberals left it in. We will need to ensure that we provide capital fund.
Your time's expired. Senator Humphries.
A further supplementary, Mr. President. I asked the Minister, will he have the decency to admit to the Senate today that 5 days before this dramatic "we'll fix the system" promise deadline is reached, to admit that the promise—
Order. Senator Doug Cameron. It's disorderly. I've reminded you on a number of occasions. Desist. Desist. Order. Senator Humphries.
Thank you, Mr President. Will the minister admit that this promise is in its terminal phase, should now have its life support system turned off by meaning that there is no fix coming down the line? The government has lost interest in a referendum to put this issue to the Australian people and has abrogated all responsibility for reform to its Health and Hospital Commission.
Senator Ludwig.
Thank you. Those opposite, and I thank the ACT Senator for his question. But of course, what the difficulty always is whether he has any decency to tell those who are his constituents that when the Liberals were in government, they took $1 billion out of the health and hospital system. What this government is doing is putting $64 billion over 5 years to address the neglect that you left. And if you want to tell us about what your plan is, I'm only too happy to hear it. I suspect it's a piece of paper that's blank, quite frankly, because what this government is doing is ensuring that we are addressing the neglect that the previous government left the health and hospital system in. 12 years of neglect. And of course, those opposite don't like what I'm saying. I understand that. I understand you don't like it because, of course, you're responsible for the neglect. You are responsible for it.
Your time has expired, Senator Ludwig.